Okay, so we're going to talk about the USMLE, the challenges of the USMLE, how to study for the USMLE, and how we can help you. We can help you with passing this test. Remember that this is what you call United States Medical Licensing Examination, and the NBME is part of it as a sponsor, and you're going to have the Federation of State Medical Board as well as sponsors. It's why that many of the questions coming from the NBME are going to be almost similar to the USMLE, or give you a kind of scoring to where you are within your USMLE itself. So I'm taking some of these information from the main website. So all the information about the USMLE, you can find them within the USMLE.org. So you're going to have, this is where actually you register, and many of the US students register through the NBME. But this is main where you're going to have what to study, and all the title and what they want exactly, and what will be the latest news on the USMLE. You remember that they change every month or every 3 months. You have something new that pop up, and this is why you need to always, time to time, or just register with them. If there is any changes, they will send you an email to be up to date. So now for the step one, remember the USMLE is one of the worst exam for specifically for foreigners. For one reason is that it's not it's not a logic exam. That is a fact. Why is not a logic exam? Because the questions, especially for step one, the questions are a little bit different from what you expect to have. This is why the student that take USMLE, you're going to have a different type of students. The first type of student would be the US students. The US students do have 24 months of study, and the US students are trained for the USMLE. So what does it mean? It means at the end of the, actually before the 6th last month, before taking the test, they have only something like a month between taking the test in June. Some are taken in July, but most of the students will take it in June. And usually these big schools for review programs, like I do, but I'm small for now, but I'm doing it. I'm doing this for more than 17 years teaching USMLE, but teaching overall, I'm teaching it for above 30 years. So at all level, from undergraduate up to residency. So teaching, I do have a lot of experience in teaching, and I know how students think. So that is one of the things. And so far, all the students that knows me that registered today, most of you, know how I operate. So the different type of students are going to be, the first one would be the foreigner. So the American students that do have 24 months, and they are trained to take the USMLE. So they don't have much difficulty, although you're not going to find 100% of passes rate. And remember as well that the recruitment for the medical school in the US is a bit weird as well, but the GPA need to be super high. So this is what you have already to start with. You're going to have a base of those type of students that are kind of nerdy. Then you're going to have foreigner doctors. What is the problem with foreign doctors? And actually, if you have foreign doctors that you practice, do not think about as a practitioner whatsoever. Think as a student, not a practitioner. And this is why one of the reasons that many of the physicians fail this exam and take it 2, 3, 4 times, even more, to pass it, because the way of thinking. And also remember, as a foreign doctors, for step one, going to see the results are better in step 2 than our step 1 for one of the reasons. All the material of step 1, first of all, has been taught maybe 20 years ago, 30 years ago for many physicians. So all this is forgotten. And the thing is that when you the basic science is not much of use besides pathology. It's not much use in practice whatsoever. You have two things that you're going to use in practice what you are studying in USMLE, and that is the pathology with physical exam and pharmacology. That's it. Everything else is pretty much is going to be forgotten unless you teach, and that is the best way to remember all this material and to become actually a better physician. Since you can have a thought of what is basic and how the processes are going to happen. Because remember that sometimes in this exam, you're going to have some diseases that are super, 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 super rare. You're never going to see it in practice whatsoever, so it means you're not familiar with it, but it's high yield. So it's, and why it's high yield, for one reason, is to, if you understood the principle of it, as treatment of physiopathology or as the microbiology aspect of it. So that so that is the second category of physicians. And remember, now the amount of physicians that comes to US is a little bit more is a bit decreased if you compare it to before, because this exam starts to become ridiculous and very expensive. And there's other countries that you can go and practice, and although it's not as easy as anything else, but you will be more considerate as a physician. As you come to the US as a physician, you're nothing. Even if you are a professor in surgery with all the prices and stuff, that don't consider whatsoever unless you take USMLE, and that is ridiculous. So the third category of students will be the students coming from these American schools, like in Europe, like in Poland, for example, that do have the same program. China, some I think school in China do have the same program as the US and the same methodology as the US. So these are students as well that are considered almost like US. The program, even the pricing, especially the Poland one, the pricing is going to be almost the same. Now, the fourth category of students are going to be the student from the Caribbean. So the student from Caribbean, which most of you are so far, the thing is, they never, one of the problem with those, depend on the school, first of all. Second of all, is the length of the program. It's mostly, most of these schools are cramming information, 2 years of cramming information, maybe a little bit of vacation between, and incomplete. That is the big issues, pretty much incomplete. So when you have a complete program and they're going to ask you this question in US, you're not going to answer obviously because you never saw them. So the program is complete and incomplete. Sometimes even the teacher that teach in those schools do not have any experience, so they cannot bring you any information, especially experience with USMLE or experience just with practice whatsoever. You don't need necessary to have. If you have a good base in practice, this is exam easy to teach. If you don't, then you have a problem, especially if you don't have experience with this exam. Doesn't matter if you pass it or you didn't pass it, but you need to have an experience of what are the questions that are going to be asked. And remember that a lot of these actually of these medical schools in the Caribbean are teaching the students as if it was a board review. Many of them are going to do this, and that is another problem, because you go to med school to teach medicine, to learn medicine with all its base, not as a board review. A board review is completely incomplete. You have many stuff that are not going to be taught, so you don't have any base. If you don't have any base, you don't know how to think in medicine. And that is the main point, is thinking in medicine. So the other issue with the Caribbean one, beside there's five Caribbean school, 5 or 6 Caribbean school that are in the top, and they have the same program as the U.S. and pushing the students. Some do not push as much. Is many of these Caribbean schools do not push the student whatsoever. So and also many of these schools, the GPA, because it's mostly business, the GPA of the students are pretty much low. There's very, very good students. Doesn't matter the GPA. There's some students that are remarkable and put the effort in it. But there's some other students, they go to Caribbean for parties, no more, no less. And this is why you're going to see that the amount of failure of these schools are pretty much very, very high. Uh, so so the issue is if you have schools that are high, that failure is high, they cannot have the accreditation needed. And accreditation means that it offers a lot of financial aids to the students, especially for the American. Canadians do have their way to have that. But also in the Caribbean students, you have multiple type of students from Africa. You're going to have some students from Asia, a lot of Indian, and a lot of American, and a lot of Canadian. Well, for one reason is that the price. The price is much cheaper than U.S. Schools, and you don't require to have the MCAT. Besides, some schools require the MCAT, but not all of them. Most of them do not. So cheaper pricing, but remember one thing as well, be careful with the cheaper pricing for those who want to go to Caribbean again, is that living in Caribbean is very expensive. So what they tell you is not what it is really. But overall, there's many lies in the results that are given for these Caribbean school, saying 97% of passage rate and stuff. Reality is you have 200 students that are going to take the exam, and you're going to have 5 students passing it. That's it. So yeah, obviously, if you have 5 students on 6 that took it and passed it, obviously you're going to have 97%. But because many of now, most of the Caribbean school, they're going to do 2 things. They understand it. They're going to have 2 things. One thing is given the student taking the NBME, and if they don't pass the NBME, they don't take USMLE, which is a good thing. At least there's not much of failure, and at least you know if you're ready or not. The second thing is that many now of the Caribbean school push the student to do a kind of clinical rotations. The good thing about this is that you're going to have a kind of clinical knowledge, but the problem is the rotation are going to be done not in hospitals for most, not all, not in academic hospital. And if you are in academic hospital, most of physicians that are going to train you want you to have step 1. At least they know what you're talking about. That, and you cannot touch any patient anyway. So that is one of the problems that you're going to face with the Caribbean school. And the other problem with it is because the Caribbean school do not do all the program, and because the students are not serious enough to take this exam. Actually, when you tell them that this is a super hard exam and you need to have discipline and stuff, they start to laugh at you. Simple as that. And then when they face it, oh yeah, you were right. That is the typical answer or emails that I'm receiving all the time about it. So when you look at these results, so these are the 3 category of students that you might face. And also the Caribbean students are going to take something a year to 2 years. Some take even 3 years to prepare this exam. Normally, if you're serious for the Caribbean, because I have the experience with the Caribbean teaching, 6 months after you finish you need to take your exam. Many of Caribbean schools, to catch up with the lack of information and the instruction that they give the student, they they oblige them to join one of these Kaplan or Baker program. Many, when they finish, they go directly to Kaplan and the Baker program, and usually they don't learn anything. First of all, it's too fast to learn, too much material. And then in any case, after that, they're going to block themselves for another year to waste before taking the exam. And remember, more you take a long time to take the exam, more you're going to have a problem with residency. Residency is going to look at this. What take you 3 years to take this exam? So I cannot rely on you. And also the score, many are going to score very low, very, very, very low. And that as well is like this is why Missouri now, for all physicians that do have a low score in USMLE, they become a PA to practice as a PA, and then maybe retake in the USMLE. But you cannot, once you pass, you cannot retake it whatsoever. So it means you are doomed one way or another. So this is why for the result and the way that I'm going to talk about how to study for the USMLE are going to be for all these category of students. But what you notice is that the passage rate for the February, this is the February 3rd, 2017 from the USMLE.org. What you notice that for American students, 95% pass the first time and get their degree. So first taker, 96%. If you compare it with the foreign students, 78%. And why of it? This is exactly what I'm talking about. So, because for foreign physicians, that you can understand totally. But for students that study the same way as American students, this is not acceptable. That's 78%. Then the repeaters, 64% pass. Once you repeat it, usually you can pass it the second time, but most of the time you're going to have them passing the third time. So repeater only in 39%, so lower. The DO schools do have almost the same level, because remember, DO school are going to take the USMLE and they take the other testing, I forget the name of that. They have another test since I did teach in DO school. The only difference between MD school and DO school is they have a bit more emphasis on the bones and the complex. Yes, exactly. Very good. Complex will be the test. So they take both of them, and usually they score very high in both of them. So there's no wonder about that. So it's the same formation, and also when the residency, DO and MD do have the same residency whatsoever. It's like a mixture between DO or like MDs. And many will not do the bone stuff. So you notice that the first taker are going to be almost the same as, because most of them are going to concentrate on complex, and the material is almost the same, and the repeater are a bit higher than the MDs. But overall, for both schools in the US, and remember, there's more and more DO schools that open. I remember when I was teaching in DO school, there were maybe 5 of them, and now you found them almost everywhere. And that is 95%. That is good. If you compare it to the non-US students, 72. And what you notice is that the amount of US students, that non-US students, or even American, doesn't matter if you're American or not, that are taking it doesn't change much. It's always the same number. So it means there's a kind of issues in here. The step 2 is going to be the same thing, but what you notice in step 2, that foreign students are going to be a bit much higher in the numbers. Why? Specifically for the physician, because step 2 is more towards practical than the step 1. So this is why I suggest to any foreign physician that are taking the steps to start to take the step 2 first, take the CK and CS testing, take the step 3, and then take step 1. Because step 1 is going to take more time, and step 1 would need more study because it's not as now. the step one become more as a step two. A lot of clinical portion of it, but mixture with basic science that will make it the most difficult because you don't expect what will be the question asked for these patients for this exams. So remember that if you notice that the repeaters is still high as a number if you compare it from the step one. So and also I'm going to give advice to you once you finish with the step one. You need to start to study for your step two right away. You don't wait. And actually, remember, step for anyone that takes step one, the step one is the preparation as well for step two, especially for pathology and pharmacology, like I said. So know those areas very good because even for step three, you're going to have all the step one over again. It's less complicated as basic science because that is mostly protocol that you need to know. But step three as well is an exam that it's rare, even for the American student, is rare that they pass it the first time. Most of the cases they're going to pass it second time, not first time, because it's very complex with all the. Remember, you're going to take the step three. Step three is not an exam for example, you're a surgeon, and they're going to ask you only question about surgery and anatomy and stuff like this. No, it's mostly an internal medicine exam, simple as that, including pathology and everything else. And this is what makes it pretty much difficult, and people forget about basic science once again. So now, if you compare step two and you compare it with step one, you're going to notice that people pass easier the step, the score of the step one is going to be much higher than the score of step two. But you're going to have more people taking passing it, passing step two. Why is that? The big reason is that when you start your step two, you don't have much time, unless you are a student that took everything, passed everything, did all the clinical, and then taking the exam. Because you don't have much time with the clinical rotations and all this. You have less time than step one. Step one, you have plenty of time to study if you have a good schedule. Especially if you can take 3 months and close yourself for 3 months, it would be great. But one of the issue here is many of you most of the time study and work in the same time. That makes it super hard to do. It seems that there's some students receiving emails that do have trouble log in. I don't know. You click on the link and that's it, I think. So the CS will have usually both a good high score for it. CS is mostly physical exam, but this is an exam that might disappear for US students because the OSCE centers that the US students do have. So, but usually the score for both of them are going to be pretty much high. So studying for step one as much as step two is you need to be consistent. Remember that this preparation, as many, especially I'm talking here for the Caribbean students that know me, remember that you start to study your step in MD1 or M1, not after MD4 or M4. After that, it's too late. You're never going to really pass it. Simple as that. You might have a chance, maybe, but otherwise, it's going to be so hard to swallow all the information that you miss in 2 years, or 16 months, or 18 months, depending on your program. One thing that you need to keep in mind: repetition. As much as you repeat it is good, because it's like a bike. More you bike, more you know how to bike. Remember, you need to have a base, and that base is from MD1. So if you finish your MD4, because I know that many of these schools pass, or curving, and don't care if you get it or didn't get it. And you know what I'm talking about. In that situation, yeah, your level of challenge is not there. You know that you're going to pass, so what bother studying, really? Sometimes they give you a kind of bunch of questions that you need to study, and you go study them, and you take your exams. That is too easy. So there's no really preparation. So the way that I'm teaching differently from the other schools. See here, repetition, repetition, repetition. This is what I'm going to do. Uh, I'm going to repeat at least 5 to 6 times some of the material, the most important material. Remember, you talk about high yield. High yield, really, you have two categories. You have those who are going to study only the high yield, and these are the ones that, if they pass, they're going to score 196 to 20 maximum. So it means they're not in a competition whatsoever. And those that do have a base and then they study the high yield. So if you have a base, it means many of question you can answer without any problem. Even the rarest question, the low yield question, you can answer them because you have a base. And this is exactly how I'm going to I'm teaching it. So I give you the base. I'm going to build up on that base, and I'm going to push you to the limit. Kaplan, Baker, yes, it's too fast for you. Unless you have 24 months before going to those programs, you need to know your material. If you don't know your material, you're out. Simple as that. Many students actually give up those school because it's too fast and because they're lost. They don't know half the material, and this is why I'm concentrating more on sort type of students, mostly physicians coming to the US taking this exam, Caribbean school students, or students that are pretty much behind, or students that did not pass this exam at least 3 times, taking it 3 times or 2 to 3 times and didn't pass it. So I love this type of students because this is how I can push them to limit and show them how to study really. So have a base first. You need to set your goal. By setting your goal, you need to set a date. When are you going to take it? What is your goal? What do you want? What do you want to do as a residency? What do you want to do? What is the score that you want to have? If you don't set any goal, what you're going to do is um, study, 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 maybe, and you don't know when you're going to take it because you're always afraid taking it. And a lot of students actually create a kind of barrier of how they cannot take it because they're not ready. Keep in mind that you're never, never, ever ready for any exam whatsoever. You take any exam in your life, you'll never be ready to it. Because if you're ready, it means you can score 120%. That is never the case. You have many factors that are going to slow you down or block you. One of the biggest factors is going to be stress. Trust me, I know one of the students that she's super bright. To be bright, she was always scoring in my test more than 95%. And all of you that are today knows my test, that are challenging type of test, she was scoring 95% all the time and above. She has even 100% in one of the tests. I'm not talking about the test that I was given in CMU. I'm talking about the real test of St. James and uh, the other school, U.S. school mostly. And this bright student, which she get a residency actually. She started residency in July. Um, she was so stressed that she didn't sleep the day before the exam. And usually in her scores, when she was taking the NBME, it was always between 250 and 260, the average score. So it was pretty much very good. She scored 250 at the exam. All this because she missed a lot of questions from stress. This is a student that was expecting her to score 270 on her USMLE. But stress get her. Another student as well, so same deal, and he scored 262, and he was as well stressed, and he missed. And this is a very a student that used to be very calm, type of student. So this is just an example of you're never going to be ready whatsoever, and there's many factors that are going to be challenging and stopping you of how to think during tests. So this was set your goal, get a date when you want to take this exam, and you're going to focus on that date, no more, no less. Your goal, me when I teach, I want you to have 260 and above. Obviously, I'm not going to have everyone getting 260, but I want you to be at least closer to 260, 250, 240. I would be happy, but I will scream at you. 250, I'd be happy making the face. 260, I'd be happy. 270, I'm in paradise. So this is why I'm pushing you as much as that, and this is why I go slowly in my lecture and repeating the material slowly but surely until you get to the point. So set your goal, set your date, know what you want to do. Okay. I know that many of you are mandatory from your school to take the Kaplan or Baker, one of these schools. I supposed to open school, and some of them agreed to accept my but it happened that I didn't have open the school, and I'm doing live webinar every day, which is almost the same thing. And the good thing about this is you don't quit your home. The bad thing about it is I cannot see you to scream at you to do better. That is the difference. So you need to have two things in mind. You need to have what is the score that you want to achieve. Once again, concentrate on it. Are you capable to have 260? Yes, you are. Are you capable to have 270? Yes, you are. Are you capable of having 196? It's easy to have 196. You know how? You take your first aid, know it perfectly, do one time or two times the your question, and maybe you're going to have 196. But 196, you're not going nowhere. Remember, one thing, especially the Caribbean school or the physician, maybe not, especially those that do have experience because they have experience practice, and the residency sometimes like people that do have experience. This is why being in nursing as a nurse or PA or in the fire department, usually they like them because they have the clinical experience. Doesn't mean that these people are going to do as well in the USMLE because they have a clinical experience. No, whatsoever. But that's one of the things. Caribbean school, most of you do not have any clinical experience whatsoever, and this is why some of them are going to ask you to do that. But at 196, you're not going nowhere. So always you start to be, remember, you're going to be in competition with US students. So you need to start to become a little bit comfortable. You need to start to think about 245 and 250. Those are to be very comfortable and sure to have a residency that is 260. But keep that in mind that sometimes you might, I know someone that did have 270 on the board, but what is the problem with that? He took it many times. So it's good to have 260 the first time. That is wonderful. But if you have it after 7 times, well, residency will not look at you as a challenging type of student. So set your goal, set how much you want. Remember the step one and the numbers for step one change pretty much, and the average US student will have 220. This is why this is the lower portion of the student. Most of the US students that I know, that I taught, finish between 250 and 270, even 275 on the board. But remember, above that, they start to have an investigation where you get that. But this is usually, before I went to the Caribbean, this was my usual score for my students. So when I went to Caribbean and I saw all these numbers and the level, I was pretty much shocked. And it take me a while before getting back to my mind. seeing on the test students scoring something like 30%, it was normal. Whoa. So set your goal, study hard, but study smart. Meaning that you don't have to swallow all the information that you're going to find. Some information are worth it, some information are not worth it, and this is what is the difference between students that are going to study by themselves, not knowing what needs to be done. Because medicine, there's a lot of information, and what is going to happen? A lot of students that do not get help, or what they. This is why these schools for board review start to pop up. Some are very old schools like Kaplan, but it's because you need a guideline. Uh, you need to follow a certain guideline to study. This is why I give schedule to most of my students to follow. Many will follow it, some will not follow it because life. But you need to have a kind of schedule as how you're going to do it to achieve your big goals. Um, so yes, the average will be 220, but you should get around 260, and depending on the specialty that you want to do. So if you are GP, if you are 240, it will be fine. But if you want bigger specialty, then you need to score higher. Surgery, for example. Many remember that for residency program, many are going to look at the score. Many programs look at your score first, especially step one first. They don't look much of step two because step two students do not have much time to study. But step one, yes, they look. Some surgical residency do not look much at step one or step two. What they look is who you are. What did you do in your life? Can I rely on you or not relying on you? So this is what they're going to look for most of the time. So there is a student wrote this many years ago. Make a plan, then work the plan. What does it mean? It's once you do the plan, once you have your schedule, follow it. Don't start okay at the beginning, the first week you are all over it, and then more you go, the second week you start to slow down. The third week you're slowing down. The fourth week, time to time. Thinking that okay, now I know everything. Remember, you're never going to know everything. That is simple. Anyone that tell you that they know everything are liars, no matter who's the guy. So you need to have this preparation as becoming try having experience, and this is a continuation of studying every single day. Usually it tells you to close yourself between 3 to 4 months and studying 18 hours a day. This is what's supposed to be done. You need to cut relation with everybody. You need to cut contact with everybody. Is about only study, 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 study. Remember, you get married with medicine, so divorce everything else. Um, and sometimes families and stuff, you lose a lot of time when you take care of families and take care of this, take care of bills. A lot of times you might lose 4 hours just like this. In 4 hours, you can read at least 2 to 3 chapters in 3 hours. So remember that if it has been seen that more you lose time, more you're going to take longer to take it, and more you're going to perform poorly. And this is why I said the timing are going to be very important. Don't go a year, 2 years. After 2 years, you're tired of taking tests and reading all this, really. So shorter timing is going to be the best thing. And also, there's many statistics that show you that when you listen to a lecture, for example, coming to class, because many students, especially Caribbean, U.S. students as well, time to time, but not, they are pretty much disciplined. But coming to class, even if you don't look what's going on, listening itself is going to get you at least 1% more on your test than anything else. So listening to lecture, reading it, listening to it, reading it again, listen to it again, are going to your ear and your visual is going to be having a kind of reflex on that material. So there is kind of website that many people like, From Fighter, and you might know it already. And this as well, it's a website that give you a kind of scheduling on your iPhone and iPad, and you try to follow this plan. If the plan that I give you did not work with your life, because usually the plan, when I write a plan, I need to look at your score for the NBME. You need to take at least one of them to know where you are weak and building up from there. And making a plan from there. Do you work, do not work, do I have family, do not have family? But other than that, try to be consistent with the plan. So there's also a lot of exam up there. I'm going to talk about later on what are the banks of exam. But usually the NBME will be one of the most important exams. There's many NBME exams, and usually I suggest the students to take at least one NBME exam per month. Why is that? And usually, because the preparation is mostly done in school, for MD4 or M4, this is where I start to ask the student to take the NBME. St. James, this is what I was doing. CMU a bit less because the quality of students and they don't follow much. But there's some students, like I said, that's super wonderful, but others, and in that situation, you're the good one. Trust me. So in that situation, take one MBA per month. The reason of that is you're going to see yourself either getting better and doing better, or you're going to see yourself the same or going backwards. So if it's the same and going backwards, it means there's something that is wrong within your methodology of studying. It means there's something that you're not grabbing whatsoever. And when you study medicine, medicine is about understanding. So, and there's some areas, yes, I totally agree with you, there's memorization. But many areas are going to be mostly understanding. So maybe the portion of understanding is not there, you don't understand the principle, you don't understand the pathway, you don't understand the disease, and that's what is killing you. So it's learning from the base how to think and how to understand, and then you go forward. Maybe you have areas that are weaker than others, for example, pharmacology. Maybe you are weak in pathology. Maybe your pathology program was incomplete, and they just bullshit you with just questions, and without giving any lecture whatsoever, or the lecture are pretty much poorly done, as I saw many of the lecture in pathology poorly done. What I'm talking about pathology here is because pathology is 80% of your step one. Pathology, it's your clinical base. Without it, if you have, and pathology is not always about pictures. And I put a lot of pictures to understand better, but it's not always about picture. If you don't understand the pathology picture, hey, unless you do pathology residency, don't worry about it. There's some pictures that, yes, you need to know them very well because it's a base, but you don't have to know everything. And during the lecture that I gave, I tell you what you need to remember and concentrate more about. So the MBA as well is going to be the exam that is going to tell you, hey, you reach your limits. It's time to take your exam. Actually, there's one of the CMU students that she was bright, very bright student. She passed the exam with 260, and actually she's every time she was taking all these MBA and certain portion of time 2 or 3 exam, she was scoring almost the same, and I told her go for it, and she did, and she scored very high because that will be the score. And also the NBN exam will give you some kind of what you're going to score on the USMLE, plus or minus 10. So if you score to 50, you must score to 60 or must score to 40 on your USMLE. So those are good scores. But if you score all the time 50, then yeah, you're very far from reality. So, like I said, it's not about memorization, but also keep in mind because normally at this stage you accomplish 2 years of studying medicine. So at this stage, you know already a lot of stuff. You should know a lot of stuff. So be careful going too deep in the material also can lose you. This is why I said you need guideline at the beginning, because if you start the chapter, if you start to talk about I don't know, any diseases, any process, in reality, when you start to go deeper and deeper and deeper, you're going to start to lose 6 months for one chapter. Simple as that, because there's so much of it. So this is why you need to start to think about facts, and you need to think about keywords. So building up keywords. And I'm going to talk about my methodology later on, but building up keywords are going to be super important for you to, especially for your questions overall. And but always ask yourself the how, the why, and what is the concept of those principles. Don't memorize, mostly understand. So, like I said earlier, the path is going to be the number one that you need to focus. And this is why when I teach about. Uh, okay, Karim, uh, you need to teach about starting from the pathology itself and then uh, building up around it. So because pathology, when you start to teach it, you start with basic science and then go to pathology and then pharmacology. But path is 80% of your material. This is why a good teaching of path or a good understanding of path, you understand embryology, you understand how pharmacology will work, you understand the physiology because you go with physiopathology. You need to know the anatomy before doing path, etc. So this is why you can regroup everything within path. The second, which is a nightmare of many, because this is, yes, pharmacology, you have principle understanding, but also you have a lot of memorization, a lot of medication that you need to memorize. And many medication look like the same, many medication, and then there is tons of medication. But remember, for the step, you need to know something like 300 medication. So 300, if you spread it within a year of teaching, then it's acceptable because you're going to repeat them many times, and you're going to repeat them in lecture, you're going to repeat them in questions, you're going to repeat them. For those who do rotation, you're going to see them in real life. And remember that all medication that you're going to learn are not going to apply in real practice. Some of them, yes, some of them, and most of them, nah. The third big important chapter would be microbiology and physiology. So remember, physiology goes with path. Microbiology can go with path as infectious disease or microbiology itself. Pharmacology, though, goes with biochemistry. So when you study pharmacology and you study biochemistry, try to study them together as where everything is going to happen. And keep in mind that the biochemistry is a nightmare for many students, and it's pretty much a lot of stuff are pretty much high yield for biochemistry, and many students actually fail the test. It's not because of path or farm; it's because of biochemistry. So remember, when you take all these exams, you need to be okay and good for most of them. You don't have to be 100% for all of them, but you need to be at least 80 to 90% for most of them to score very high. So this is what you study. So it depends how weak you are, because sometimes I will suggest to go over microbiology by itself and then mix it up later on with systemic studying farm or biochemistry by itself and then go to systemic. But the best study will be a systemic study per organ, and you go from there. So the most important organ are going to be cardiovascular, renal, and then reproductive endocrinology, and then the GI, and hematology are very big as well in USMLE, especially the leukemias. And remember, one of the areas that is taught in path, farm, macro, physio, molecular biology. Microbiology is also another nightmare that because remember a lot of questions are asked by PhDs and PhD love they will ask you a question on what they're doing. So this is why microbiology is going to be very deep in some questions, um, especially immunology and inflammation. Those are a lot molecular biology in it. So there's two chapters that many students leave at the end or forget about it. That is behavior science, and USMLE is heavy in behavior science, psychiatry. In step one or step two, you have a lot of psychiatry going on, and so don't miss this question because psychiatry can come with pharmacology as well, all the neuroleptic and stuff like this. So you need to study the clinical aspect of it and the definition. There's a lot of definition that you can go over. Epidemiology, you're going to have at least 3 to 4 questions per block. Epidemiology, this is the easiest subject that you can have winning points. That is a problem. Many students do not study it, and you're going to lose 3, 4, 10 points per block. Why? Why you want to do that? Don't do that. So what I suggest usually epidemiology every Friday or every Saturday, you go and review your epidemiology. You take your first aid, the 3, 4 pages of epidemiology, know them, know the first aid very, very well, and you're going to be fine answering all those questions. Um, so the focus usually will be in also the first focus on the within the question for the USME are going to be the preventive medicine, and so every time you look at the treatment, think about preventive treatment first, and then everything else. The second thing is to understand the mechanism of diseases. It's about pathology, physiology. The third would be mostly knowing how to make a diagnosis from a question, and to be able remember that most of your cases are going to be clinical cases based on history of a patient, physical exam, lab. So know your lab, know your basic X-rays, and actually I'm going to start next Saturday X-rays. And know how to make a diagnosis. And usually from the when you read the beginning of the questions, you're supposed to know and supposed to have the diagnosis by the end of your before finishing your question, you have your diagnosis. But be careful here because sometimes the question is not about diagnosis, but it's going to be something else. Sometimes they give you the diagnosis, but the question will be biochemistry, would be pharmacology, etc. The first is to apply what you learned in real life, principles, management. So how to treat a patient, and like I said, prevention will be number one. How to treat the acute situation versus the chronic situation. And the first, before treating, is to recognize them. Recognize what is an emergency versus what is an acute situation, what is a chronic, and what is not an emergency. So it's a way of thinking, usually. So this is why when you study, the way that you study it is to define yourself, what you are dealing with. Uh, 35 years old female comes from fatigue. That is your definition. What are the causes of the fatigue? How you recognize fatigue? What is the association with the fatigue? Is it an emergency? Is it not an emergency? Is it chronic or is it acute? So the time frame is important. Sex will be important. Age of the patient will be important because each pathology will depend on age of the patients. So you're defining yourself by looking at all this information as if the patient comes for the first time to see you and you're going to ask them this type of questions. So then is to recognize the symptoms, to recognize, for example, the pain, where the pain start, does it stop? Is it the stomach? Is it the pancreas? Is it the muscles? So recognize it. So the recognizing, it's pretty much clinical with all the symptoms of presentation. Is going to be laboratory that you're going to ask or given to you and you need to recognize it by the investigation as imaging, X-ray, CT scan, ultrasound. Remember, ultrasound most simple test. Uh, the specific testing as imaging or specific lab testing like immunofluorescence, for example. And remember that, for example, if it's a cancer, a tumor overall, autoimmune diseases, or if you don't know, still do not know, the diagnosis of biopsy will be always required. Biopsy usually, you don't need biopsy all the time, but biopsy is going to give you the final diagnosis most of the time. And then once you have this, you attach it to a cause. What does it mean attaching to a cause? How many causes you have? You have genetic, environmental, tumors, infectious, vascular, etc., inflammatory, etc. So you need to attach it to one of them. And then once you have it, you have the cause of it. This is what you're going to treat it. So the treatment will be the preventive treatment, medical treatment, surgical treatment, radiotherapy, chemotherapy, or others, like chemotherapy, for example. So there is many others. Acupuncture, but usually they will not get asked you for acupuncture for the USMLE. So the resources. The first thing is from M1 or MD1 is to have your step one, your first aid book. So the first aid book, by the end of MD5, MD4, you need to know it back and forth. Without any problem, you need to know everything about it, back and forth. Why this book become the Bible for USMLE is because it has everything resumed, and it has the most important, what you call the high yield material for USMLE. One problem is, and actually they try to update themselves every year. So every year you're going to have a new book. The 2017 seems to me that is emptier than 2016, but but this is a book that is incomplete. There's a lot of information that are not there. Sometimes you have errors, but usually they send you the correction of it. If you look at the end of this book, you're going to see the path guy was part of his team, and we were working questions and stuff for the board, and so we contribute to this book. But remember that this is a book that you need, either you put it in a spiral type of folder, or you leave it as a book and add pages. Why I said add pages? Because normally when you go to lecture, if you're still in med school, or you're taking a board review, or you're reading, you need to add the information that are missing to each of the chapters. So this is why I said you need to start with it in M1, because you need to add, because you're going to add all this information by the end of the MD4. You're going to have all the information needed for your step. Simple as that. You don't need any other book during that time, because everything is in this first aid that you did add to it. And see that you don't. And since this is a book that you read 5 times already, and you add yourself the information to it, these are information that's supposed to be known. So you don't lose that much time going and reviewing and rereading from as you were a freshman. Not at all. You have already there. Everything is there. So if you didn't do this, that was your mistake. Some of the books that are very important as well, there is the NMS book. The NMS book are good for step 1, step 2. And there is BRS book. BRS books, some of them are good, some of them are not and are not that good. And that's for BRS, sometimes there's some mistakes. The question of BRS are with mistakes and too easy sometimes. But BRS physiology and are going to be one of the Bible book for physiology. Roadmap, you can remember when you study anatomy, you need to study clinical anatomy, not descriptive anatomy. In school, we teach descriptive anatomy and clinical anatomy. Descriptive is mostly to know where everything is and the trajectory of the vein, trajectory of everything else. And so this is how you're going to pretty much follow it. But clinical anatomy is starting from symptoms. What is the relationship of the organs with others, and what are for example, you have the gallbladder with pain. Why the pain irradiate through the shoulder? Uh, that is because of phrenic nerve, the right phrenic nerve irritation. So that is clinical anatomy. Embryology, you can use first aid and or the high yield embryology. First aid would be more than enough. Don't waste too much time in embryology. Just the basic would be good, and that's enough. Have the all the embryo, how the embryos form. That is mostly for BGYN and stuff. And what are the different tissue, and this tissue give you what and when. That is the high yield for embryology. Histology, that will be very important for pathology to understand, and you need to know your basic histology of it. Uh, you look at the organ, you know what organ it is. What you need to know what are the tissue, and also histology will be very important for tumors. If you don't know your histology, it will be very hard for you to understand tumors and how to name the tumors and how the tumors are going to act. Neuro is one of the nightmare of many students and one of the weakness of a lot of students. So this is a chapter that usually I ask students to stay a bit more longer to know the everything about it, neurophysiology, neuroanatomy, and you have many books for it, but goes through the neuroanatomy through clinical cases. This is one of the very good books that start with case and then start to explain the clinical anatomy of it. Look at the atlas. Why the atlas? Because you're going to remember that anatomy and neuro, the question for USMLE are going to be as X-rays. They show you an X-ray and tell you what is the structure, or they give you an X-ray, what is going on. And this is why if you don't know the location, especially with the brain and the other, if you don't know the location, it's going to be very hard for you to determine if there's a pathology going on. So biochemistry, you can start with the first aid and then add to it, especially the high yield biochemistry, BRS. Biochemistry is good book. You're going to have the typical type of books. That's super good book for biochemistry. So we go over it from beginning to the end. Path, you have many paths. It looks like pathoma. Pathoma is completely incomplete. It's good, but it's completely incomplete. I prefer really the BRS book. Go with the big book of Robin book or the small size book, and that will be really your Bible. Actually, this is Bible for pathology. So keep going that. You can use my website, my PowerPoint. Usually my PowerPoint I complete. I put all the information that are important for USMLE and for practice. So Patoma, some look at the video of Patoma as well, and I see a lot of actually Caribbean school students that are going to study only board review and look only videos about Patoma or whatever, and usually they all fail because it's incomplete. So don't go with board review. Goes mostly with all these big books first, and then go from there. So the microbiology first aid would be helpful, or the big picture microbiology, or there's a book that will show you picture made microbiology made easy or made simple. This is a super book. This is every student love it. There's everything in it, and it's pretty much very simple when you look at it. For immunology, NMS. This is one of the book for the big review. And you can go with the first aid. Like I said, first aid is always there. Pharmacology, Kaksung are going to be the base with first aid, and many of books, for example, the Kaplan books are completely incomplete. This is what they follow when they start to do stuff in Kaplan. So it's too fast, pretty much incomplete. You need to add information to it. So the flashcards for Kaplan are good, or these two essential but like I said, you need to add to it because they are incomplete. So for the questions, the bank, there's many banker questions. Any question is a good question. So uh, do not limit yourself or doing as much as questions. But there is some bank are more important than others, and the U word are going to be one of the best bank so far because very close to USMLE. And usually I suggest starting doing the U word question from MD4 or M4, and you need to do at least 3 times the U word questions. Um, the second, which I suggest you to do as well, and this as well, you can do it starting from M4 and D4, is the Kaplan quiz bank. The Kaplan quiz bank need to be done at least 2 times because they are challenging type of questions, pretty much challenging, and this is what you need sometimes. Remember for USMLE, one thing that you need to learn is to read fast, think fast, and answer fast. But be careful, don't do the mistake of how you're going to read your material. But think fast, read fast, and do fast. So for step 1, step 2, these USMLE U word and Kaplan need to be your base questions. Start with that and then do everything else. Score95.com as well do have very good questions that are similar to USMLE. And one of the websites that I found out, which is completely free for 6 months, so you give them just a date when you take in, you have a lot of questions that are simple, but these type of questions are good for a reminder and going over and over and over and over. The RX questions are too easy, too simple. These are the questions for the first aid. You can have videos with them as well. So these are mostly for when you are MD4, MD3, M3, and go over them. That are going to be a training for you. Even after, for the physicians that take in USMLE, you can go and do these questions as well. But once again, they are pretty much simple type of questions. And like I said, you need to take at least one NBME per month, starting from MD4, and build up on that your weaknesses. Now, there's many other training courses that you know up there, Doctor in Training, which is online. One of the courses that I suggest as well, beside my courses, will be the Baker cases by Lion. He goes over the cases like I do most of the time and dissecting the causes. This is a 1 week course. He does that at night time, and it's mostly how to think for when you have questions in front of you and how to dissect them. So I do this as well. The other sources that you can have, Current Fighter, which is an application for your phone, which you can have, once again, schedule done over there. There's so many more than that. The secret book. I suggest all students to have a secret book even during when you're taking right now your USMLE. Why the secret? First of all, when this book comes out, it comes out almost the same time that I get my USMLE. Long time ago. So this is a guy that scores super high on the board. I think 95, 99%. And from there, he started to write the questions. He started to write these books, and now these books are pretty much very interesting to have and very helpful as well. So I suggest you to have all the for step 1, step 2, all the secret book, and go from there. Step 1, the way that this book structure will be questions and answer, and the answer are pretty much detailed on the answer. And you have for step 1, this one is mostly question and the answer. Pathology specific, concentrating on what is important in pathology. The high yield and not as high yield, but can be question for USMLE. and the clinical anatomy that many Caribbean school usually miss. So this is the book that I said, the Make It Simple, the one that I recommend, especially the clinical microbiology. This one is all students love it. There's everything in it, and you're going to have others as well from the same series. And the Major Ridiculous Sample. This is a German, actually physician that passed USMLE a few years back, almost like the almost like the secret books. Um, and she struggled actually passing USMLE, but once she did, she wanted everyone to know, and she made the first book was a step one, and then step two. So the other sources that of book that I like, so the Golden Path Comprehensive Review, this is good, and remember this is a guy that's teaching in Caribbean as well. The Robin Review Path questions. Remember these are easy questions, but they're good for practice. And the web path, this is something that you need to do absolutely. Web path if you are weak in pathology and stuff, but start reading it. So BRS, like I said, physiology is going to be the best one, or you're going to have all these comprehensive rapid review books, which are pretty much good. You have all the information, almost all the information in here, so you can take your first aid and these and add information between each other, and you're going to have a pretty much complete set of books. So the NMS will be more for the, you can have a step one, especially immunology. Otherwise, step two, when you finish taking your step one and you pass your step one, you start to get this book and start to read about them. And for the step two is mostly when you do your clinical rotation is to go over this book for all the diseases that you're going to see or not see and know them, and creating a flashcard from it. So flashcard is another methodology that I suggest to students, and that is how you're going to do your flashcards. Flashcards are mostly for high yield or keywords. So in the front, you write the question, your questions, and in the back, you have the answer. But the answer in the back need to be very simple. For example, if I say, I don't know, how to recognize necrosis on a cell. That is the question. In the back, how are you going to answer? Non-nuclei. Simple. I didn't ask you what is the different type of necrosis or whatever. I said, how do you recognize a necrosis on a slide? And that is non-nuclei in the cell. So this is how you need to build up your flashcards overall. So for this book, you have each specialty. You're going to have few of them, and read them from the back to. So now, what is the most important thing for your USMLE? There's one thing: doing questions, nonstop. So, but before having a question, like I said, you need to have your base first, knowing the base, and then you build up on it. So during the day, at the beginning, I suggest you to do something like 20 questions, and then go to 50 questions, 80 questions, 100 questions, 200 questions. So every day, you do that. Saturdays, you do mostly questions. So now when you do questions, you only go over the question that you answer wrong. And you ask yourself this: why did you answer it wrong? Because maybe you didn't know how to read the questions, maybe you did not understand the questions, maybe you read it too fast, or maybe you missed something within the question itself. So from there, you need to start to fix yourself. And the question that you answer it wrong, what you need to do is go back to the boarding driving, and you need to reconstruct or read it again and again and again until you get it, and you need to understand it very well. So those questions that you did wrong, you're going to do them again later on. Remember, you're going to do all these questions again for at least 3 times. So the second time that you're going to do that, those type of bunch of questions, you need to read the wrong answer and the right answer. Even if you answer them correctly, you need to read them again. That is reinforcing your memory. And if you do the mistake twice for the same question that you read about it, it means there's a really big problem that you need to ask yourself, what is that problem? To try to really to fix it. But go back all the time that you answer it incorrectly, you go back to the drawing board and you read it again. So remember, you need to read all the books that I showed you again from the beginning. But also some of the books that I didn't put in here, for example, the Merck's book, that is mostly for step two, but you can start to read it for step one because this is mostly clinical. And remember, step one is a lot of clinical based now, mostly. It looks like step two sometimes. And the question are going to be pretty much similar for each of them. And so you need to, and the other one would be the Harrison. The Harrison as well, you can start to read it from M1 to M4 and after. And the Harrison is internal medicine that will follow you until the residency and after residency for those who do internal medicine. But Harrison do have all the information that you need for a clinical question. So this is why these two books need to be always in front of you. You start to read the like I said, all the books, not the review books, but the normal books, and then you go back to the review books, and then if you still didn't get it, then look at the Merck's or the Harrison. Remember that when you read something, you need to read it at least 5 times. Repetition at least 5 times. Why 5 times? Because this is how the brain is going to work. The first time you build up kind of pathway, new neurons. Second time, you have the connections that to become start to become strong. The third time, the connections are there. The neurotransmitter acetylcholine goes fast. The fifth time, the fourth time, fifth time is to usually is the reflex that's happening. You see it, you know it, you answer it. And also you're going to do that 6 times, 7 times when you do questions. So like I said, repetition, repetition, repetition from the beginning, and think about it pretty much smartly. Don't make it too complicated. Think simple. Many of the questions are really simple. It's just us that make it complicated, and this is why we miss it. So like I said, you can start with 30 questions, then 50, 150, 150, and 200. But remember that every time you do that, you need to read the wrong answer. And this is normally your 3 months of study, uh, doing only questions. So like I said, you need to have something like 18 hours a day studying. So usually, what I suggest a lot of time, this is the typical schedule for all students are going to be in the morning. This is when you're going to read. Uh, Remember, you're going to follow a certain schedule. So you're going to start to read. Either you're going to read about anatomy, biochemistry, pathology, whatever the subject. In the afternoon, so you do this from 8 to 12, just reading. And then the afternoon and then you take 1 hour lunch between 1 to 5. This is where you're going to do questions, 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 and read about the wrong answer. So you do a block of 50, block of 100. And remember one thing as well is this long hours of study are not just to bother you. They are mostly to build up resistance. Keep in mind that you're going to take an 8 hours exam for step one and 7 for step two. So, and 2 days for step three. So it means that your mind need to be very much resistance. And your mind need to be as sharp as if it was the beginning, the first block. So if you're not used to study that long and do that long, your brain is going to, remember, brain are lazy. So the brain are going to make you lazy very fast. So you're going to take the two first block and then the block 3, 4, you are tired. So by doing that and doing long time questions, For example, you do 200 questions within 4 hours non-stop, and this is for those who join the board a long time. This is what they do at the end. They take 4 hours exam non-stop, and that is building up the resistance. So you can do two blocks and the first two blocks, second two blocks without any problem. And then the fatigue, a little bit of fatigue, will be the two last block. And remember, actually, this exam, which is different from any other exam, is going to be about the length and the fatigability. So maybe the first block you're going to do very well. Second block you start to be tired. Third block you don't see anything. The fourth block is bye-bye. And this is why a lot of students miss this exam, even if they know the material, because they get tired very fast. And remember, it's a training. You don't learn it just like this. It's pretty much a training. So this is why I suggest to start with 30 questions, 50 questions, and then 200 questions within a week, and then maintain 200 questions every single day. So so that is from 1 o'clock to 5 o'clock, questions, and then take a break, 6 to 7, 6 to 8. What I suggest you to do is to read articles from latest articles from journals, for one reason. The latest articles on the subject that you are doing within that week, for one reason. First of all, the articles will allow you to read cases, to read fast, to learn to read fast, and to process all the information that exists. So, and also these will tell you the latest lab that are asked, the latest examination that are asked, and the latest treatment as well, with complication of those treatments. And keep in mind, the USMLE are going to ask you about these latest treatments, these latest disease that happen. For example, they can ask you a lot about Ebola and all the latest infectious disease, and there's plenty of questions now about those that 5 years ago they were not, because they were not as important as they are right now. For example, Zika with all the malformation in pregnancy. Those are big questions now. So if you don't read the latest information, then you're going to be behind, and many questions you're going to miss. And keep in mind that any question is an important question to get you toward 260 and 270. If you start to miss, oh, this not, okay, it's fine, I'm going to miss this question now, I'm going to catch up with them. No, you don't catch up anything. A question that is missed is 1 point lesser to the big score, and that is an issue, okay? So like I said, many of the Caribbean students, this is how they're going to think is, oh, I'm going to catch up later. No, you don't. Once it's gone, it's gone. So also, you need to start to use the media, especially now for your USMLE Step 1. They're going to put you either videos, or going to put you sound, heart sound, and pulmonary sound. Know those sounds. For my program, usually I send you the sounds and to hear, and sometimes I set up exams about the sound you need to recognize. Same deal as knowing your EKG. I know that, especially for physicians that taking this exam, many do have specialization that has nothing to do with what this board is all about. But you need to have those, you need to know those bases, even if it's asked for internal medicine or whatever. So you need to know the endoscopy, how the endoscopy look like. You need to know the EKG. There is something like 25 EKG for the step that I cover within the board review that you need to know very, very well. Some might not have, remember surgery, for example, for step 2, are not that much of high yield. Some questions are asked, some questions are not asked, but it's mostly internal medicine that is high yield. And that is one of the difficulty for some students that do have specialization, thinking in their specialization and forget anything else after that. So remember, as a foreign physician, you need to think as a student, and you need to restudy like if you were a student. No more, no less. Otherwise, you're not going to make it. Ultrasound. Ultrasound is part of the X-rays. Like I said, I'm going to start to the X-rays this Saturday, next Saturday, coming Saturday. Physical exam as well, because they can put you a video about physical exam, especially a neurological physical exam, and ask you what's going on. And most of the time, the questions are going to be pretty much short type of question, adding the media. So be familiar with those medias. YouTube is a big saver for that. There's many websites up there that use videos, and so get familiar with all these videos. So like I said, schedule. So far I gave you the need to review your cases between something 6 to 8 or 6 to 7. And then after usually for my board review, sometimes we have lecture morning and the afternoon, and sometimes, but most of the time is going to be between 5 to 8 or 6 to 8. The schedule usually change depending on the lecture that I'm giving, but between 8 to or 9 to midnight, usually the brain is very tired then. So you need to do something that is passive, but in the same time, something that cuts your brain. So this is why looking at videos, for example, Kaplan videos, my videos again, and all the other videos that you want that explain well, this is why you're going to look at them, and that will your brain is going to register something about it, and after midnight just go to sleep. Or if you did flashcards, like I suggest you, is between 11 to midnight before going to bed to read the flashcards again and again and again and again. The more you read them, better it is. I know it's boring sometimes to read the same thing, but if you don't know it very well, it means you cannot uh, perform. So schedules, like I said, if you join, I give you the schedule, depending on the NBME and many stuff. And otherwise, create your own schedule or go to these websites that create your schedules. Remember that studying is individual. You need to study by yourself, no distraction whatsoever. Like I said, you are married to medicine, you don't have friends, you don't have Facebook, you don't have Twitters, you don't have anything. It's you and your books and your questions. That's it. Which make it very difficult sometimes, but this is the way. This is the discipline. And like I said, most of the students need to take something like 4 months to put all this. Try not to go all a year because you become fatigued. 2 years for sure you're fatigued, going to fail. But between 4 to 6 months, that is the best timing. But so, like I said, it's individual. But what I suggest you is, as some of the group right now that that study by group, you need to study with the group at least uh, 2 hours a week. For example, on Saturdays or Sundays. And why studying in group like this is because some stuff that you don't know, you might learning from the group, and that will reinforce your knowledge and your learning. And also the way that you need to study with this group, it's not specifically doing questions, but asking each other questions. So when you ask each other a question, you have only 30 seconds to answer. If you don't answer it within 30 seconds, or you're hesitating answering it, it means you don't know it. And if you don't know it, it means you're going back to a drawing board and restudy it again and again and again. So that is the interest of doing that. And also, as an individual, you need to study from Monday to Saturday. Uh, Actually, from Monday to Saturday, from 8 to almost midnight, with some break between. And usually, sometimes, unless you're doing question, if you do question, just sit down on your chair and don't move. Unless if you're reading, what I suggest you to do is every half an hour, go for 5 minutes, walk around and come back and sit down and study and read it again and keep going reading. So from Monday to Friday, I suggest you between 8 to midnight with those break. And Saturday, study just maybe from 9 to 2, and take the rest of the day off. Sunday, you might do maybe 1 hour, 2 hours questions in the morning, and then take Sunday off. You need to relax, otherwise you're going to be crazy. Uh, and do something fun, not staying home. That would be crazy. So where to study? So depending on students, some are going to study in their apartment, but sometimes studying in their apartment can be a problem for one reason. Uh, this reason is in your house you have a lot of distraction. You're going to put TV on. You're going to go to the bathrooms 10,000 times. You're going to the kitchens 10,000 times, and it means you're not going to be efficient enough. So yeah, if you are comfortable and you have a discipline, do that. If you don't, then don't do it. Some study in their parent house, so that depends. Some go to library. Library is a little bit more disciplined because you need to be quiet. You cannot talk to no one, and you can sit down on a chair for 2 hours straight, and then taking a break, and then 2 hours straight and taking a break. So the library will be one of the best area, but also sometimes you need to change scenery as for mostly for your brain. The other thing that I suggest you is before taking, you can take your NBME at the Parametric Center, but I suggest you to take at least one time or two times one NBME test at the Parametric Center. For one reason is to get familiar with the software and to get familiar with the areas, how a real exam is going to happen. At least your stress is going to be much, much better than if you don't know what is going to happen next. And remember now, for the Parametric Center, nothing is allowed. So leave everything at home. Just go with your IDs, and that's it. Nothing else. Maybe your lunch, but even lunch, I don't have. You don't have time because the way that you're going to take your exam will be 2 blocks, take 5 minutes break, 2 blocks, 5 minutes breaks, and then 5 to 10 minutes breaks, and then the two other blocks, and you're done. Um, so you are not going to have much time to eat. And if you eat between, don't eat something heavy because you're going to be sleepy. And sleepy, this is not good for reading questions. You're going to blink. So have something very light that day. Have a good breakfast. So once again, you need to have your balance. You see how at what time I told you to stop studying around midnight. So from midnight to 6, 7, that is 7 hours of sleep. 6 to 7 hours of sleep. That is good. You wake up 7, you take your breakfast, you go for a walk, or you go to exercise for half an hour. Walk would be good because the blood is start to move, and swimming is the perfect exercise. Dancing as well. So if Sunday, Saturday night, or Sunday you can go to dance. That is as well making the blood moving in your brain. That will be good. Uh, that's this is a question where you say, Manny, what is the best way to sleep and why? Uh, so so how to study? This is what I was telling you. Repetition. Read your. So now, when you have a question in front of you is pretty much read your question carefully. Read it fast, but read it carefully. While reading carefully is because all the information to answer your questions are there. Unless you don't know anything, that is another problem. But if you read it very well, you get all your information. You need to understand your questions. Don't jump to conclusion. Don't jump to the answers. Like I said, when you start to read the question from beginning to the end, before getting to the end, you know already the answer to the question, and that is the main of it. This is what you need to be careful as well. You have the diagnosis, but maybe they ask you biochemistry, and this is a process that is in your brain. Need to include all this type of questions. Can be a biochemistry question, physiology question, anatomy question, or whatever. So understand your question really well, and actually 90% of the questions that are answered wrongly is there's two reasons for that. Either the student did not understand the question whatsoever, or read it, but did not catch up the keywords, or they went back to the question and changed the question, changed the answer. Once you answer a question, never go back and change it whatsoever. Why is that? Is the unconscious? It means the first time that you answer it was the unconscious that tell you to answer it. When you start to intellectualize the answer, then you're going to answer it wrong because you start to doubt. So this is why don't go back to the question unless you answer the question and just to keep moving. That is another issue. So you need to put order of importance. What is important in the question that is asked, and is it the clinical part of it? Is it the lab part of it? And take notes if you want. Taking notes, that is mostly when you train, when you do it at home, but not when you take your exam. When you take an exam, you need to be forward. Remember, you have 1 minute to think, 30 seconds to read, 30 seconds to answer. That's it. And you keep moving. So compare with what you know, meaning that uh, anything in this question did not understand or you didn't know, not know. If it's the case, it means you have a lacking in one of the areas. Like I said, can be biochemistry, can be physiology, can be anatomy, can be psychiatry, can be internal medicine. So depending, step one, step two. And like I said, when you read your case, you know already what might be the answer before the end, and actually that makes you answering the question faster than anybody else. If you don't know what will be the answer in that case, you have no clue of it, then it means you're lacking a lot of information. Lab can give you a lot of information. The beginning, actually, the to have the diagnosis from the beginning, you have your diagnosis before even keeping going. Even before looking at your lab, you have already your diagnosis. But you need to build up with differential diagnosis. So you have a differential diagnosis that you're going to eliminate because you start with some clinical aspect of it. The lab eliminates you half of the differential diagnosis, and then the rest of the answer are going to eliminate the what is not part of the answers. So is going to be very fast when you think about it. Look at your options. Sometimes the answer is in front of you. You don't have to bother. But sometimes be careful English and be careful grammar and be careful how the answer will come. And sometimes you have some answers that look like the same. It's just one word that is different between them. And those are the hardest question because you don't know what to answer. You know the answer, but you're stuck with that. So in here, you need to answer what is the best answer of the best answers. And USMLE love this type of thing. And this is why when you look and you go with your keywords when you study, this is what makes the difference between all of these different answers in here. Remember now they don't give you except, but that would change with one of the best answer will be. So it means one of the best, that is the hardest. Why? Because maybe 5 of these answers are going to be correct. Which one are you going to choose? And that will be the keyword differentiation between them. So like I said, when you lock your answer, you don't change it. You keep moving. Forget about it, and don't ask yourself, oh, maybe it is, maybe it's not, etc. So now, if you, unless there's some questions that are tricky, if you don't know your answer once again and you don't understand, so it means you have a lot of problem. And this is why doing a lot of questions are going to help you for the USMLE very much greatly. There is some students though, what they do is they don't read anything. They don't read the books whatsoever. They don't base what they do is just doing questions, and that's it. They learn from the questions. The problem with that is, yeah, you can do all the questions. Maybe 20% of some questions come back on the test. For example, you see the one of the tests that they give you on the USMLE page, which there's 50 questions, I think. Do those questions, the simple questions, because you're going to have at least 20% of these questions coming back to your test. So do them, know them. But you might have, for example, if you do Kaplan question, maybe 10 questions from Kaplan come back to your test. Yeah, but how about the rest? So most of the students as well are going to fail, or if they pass, they're not going to pass with the high score. Because remember, it's not only about high yield, it's about everything else. This is why some from USMLE say, what does it mean high yield? It doesn't mean anything. We can ask you anything. Keyword, yeah, maybe, but high yield doesn't mean anything. And this is one of the mistakes of many students that fail USMLE. Come on. So, like I was saying earlier, only review the question that you answered, either correctly or incorrectly, but start with the incorrectly, and then later on when you redo the question, read the correct answer as well. Because if you answer it correctly the first time, then it means you know your material, unless you guessed. If you guessed in this situation, you need to go back and review it. Uh, in USMLE, you don't guess. Either you know or you don't know. If you don't know, go back and study it again. If you know it, then you need to know it very, very well. As if I ask you your name, you can give me your name without thinking about it. This question will be the same thing. You need to answer the question without even thinking about it. You need to be natural. Um, is it going to help you for practice? Yes, it's going to help you a little bit for practice, a lot. It's going to help you for step 3, going to help you for step 2 as well, because the same material are going to come back, but a bit differently. I remember step 2, for example, pharmacology, one of the important things is to know the dosage and how many times a day. In the step 3 is going to be the protocols that you need to learn, as these are the protocols of hospital. And this is why when you take your step 3, you can practice. You can do an internship and practice even for if you do it for 1 year. And many, like in Florida, if you have your step 3, your steps in step 3, even if you didn't have residency, you can, under advisement of a physician, you can practice. So step 3 give you the practice stuff because it's protocol. So, like I said, redo the questions all over the place. Sometimes the questions are bad questions. There's some books that are horrible. So don't do those questions. And this is why you need to start with the U word and Kaplan. These are super high yield questions, and also, like I said, they are pretty much selected and looking like the same as USMLE. And remember, the question in USMLE are long enough, not like the NBME, 2 lines or 3 lines, and that's it. You have more above 250 words per question. So this is why you need to read fast, think fast, and do fast. For example, in here, in this type of question, even if you didn't do it, sometimes some question you can guess what would be the answer just by thinking a bit about it. For here, you have a 38 years old woman. So she's a woman, 38 years old. So already in your mind, she's young. So what are the diseases that you see in a woman that is young like this? So it's mostly GYN disease or autoimmune diseases. These are the biggest disease that you might find in a woman. And then you have anything else. Tumors, you don't think much of tumor at that age. But the other information here is congestive heart failure. Already here, what comes to your mind, the dyspnea, lack of oxygen, and death can happen. But what are the causes of this congestive heart failure? That is the big question. So either they would give it to you, or it can be a question about her congestive heart failure as the cause of it, or it can be how you're going to treat it. These are the 3 big questions when you look at your case. So, but in here she has premature ventricular contraction. So she has just beating that are extra. So, but this question I can put you in EKG and ask you to what is your diagnosis from that EKG. But already they give you the diagnosis, premature ventricular contraction. But also think about what is the complication of premature ventricular contraction. Is she protected for that or not? Because one of the questions that can be here is how are you going to treat premature ventricular contraction in someone that has congestive heart failure. So here is knowing your medication. You don't have to know the dosage for step 1. And also the information that they give you repeated episode of ventricular tachycardia. Ventricular tachycardia can be a danger. A VTAC can kill your patient. So that you have the accuracy of it and you have the emergency that start to happen. But if she doesn't have much of symptom about it, that can be also benign. Her blood pressure is totally normal. So someone that has congestive heart failure. That is nice. And there's no murmur. So it means that here the origin of her heart failure, it's not valvulopathy because she doesn't have any murmur. I remember number one cause of valvulopathy, especially mitral valve, will be rheumatic fever. In this case, they don't tell us as well that she has rheumatic fever. Her heart rate is markedly enlarged. Yeah. Coronary angiography show normality, so her coronary are totally normal. Huh. So already here you have a guess what type of congestive heart failure that she might have, and she might have it for a long, long time. And because her heart is very big, this is why maybe she has ventricular tachycardia, and because the biggest the wall might be thick and pushing against all the connections and conductions. And now here, which of the following is the most likely diagnosis? But so what do you think? You have plenty of keywords in here. So the question here is, what will be the most common causes of congestive heart failure in young women? And that is pretty much pathology knowledge. So already you're supposed to have the answer before looking at your ABCDs. So is it acute rheumatic fever? Already in my case, by thinking, I did eliminate that one. Why? Is because there's no murmur. So there's no valvulopathy from it. So that, I don't think so. Congenital fibroelastosis. Where's the other symptoms from it? I don't think this one would be a good answer. Constrictive pericarditis. Where's the jugular? Where's the other symptoms? Hepatomegaly maybe, or what type of constrictive pericarditis? Myocardial infarct. So far, they tell us in the case the coronary angiography are normal. So this one is eliminated right away. So what is the most common cause of congestive heart failure in a young woman? Primary cardiomyopathy. This one is more attracted, and this is the answer, primary cardiomyopathy. So here is a knowledge of pathology and what are the most common causes of some of the diseases. And this is when you create your flashcard. This is exactly how you're going to create a flashcard. In the flashcard, the question will be most common congestive heart failure in a young woman. What are the causes of it? The first one would be primary cardiomyopathy. What are the most common cause of valvulopathy? That will be mostly rheumatic fever. What are the most common valvulopathy in the elderly patient? That is mostly probably calcified aorta. And so by creating all these flashcards, this is how you're going to have your keyword, and this is how you're going to think about the answer very fast without even looking what they give you as an answer. So for example, in this case, it might be a bit tricky. 65, old, white female. So that present to your office with a chronic productive cough, chronic productive cough. So now my question is, what is the color of her cough? What is the, not the color, what, does she has a sputum or she doesn't have a sputum? If she has a sputum, what is the color of the sputum? Is it a lionic sputum or is it a pretty much red sputum? That color it, or it can be very yellowish type of sputum. But because she has chronic cough, my first question is she a smoker or she's not a smoker? Because if she's a smoker, I'm going to think about metaplasia that might happen within her airways. Especially that she's old as well. Old, what you can think? You can think about cancer. You can think about most of the old, you're going to have cardiovascular issue happening with them. And also, since this is a long chronic productive cough, can be caused by cancer. So that is all your differential diagnosis that you need to eliminate with your case. So she produces over 2 tablespoons of sputum each day. Okay, so it's productive. And her current cough has been present for 3 months. So 3 months is mostly it's mostly acute going on. Some situation, 3 months is chronic, but and here 3 months is pretty much acute. But what they're telling you here, history revealed that she has similar episodes of chronic productive cough that lasted more than 3 months each of the past 2 years. So it's something that is recurrent, that is coming back. The question is it specific during the year or it's not specific during the year? Because if it's specific, it might be because of cold, it might be because allergies, etc. So these are all the information that are going to be pertinent for your case. But here they tell you that already, see, I'm going to eliminate the allergy because they tell you different season of the year. So no matter what, it can happen at any time. It's not specific. So that's why you eliminate already the allergies from your case. So the most appropriate diagnosis in this patient would be what? Already supposed to have already in your mind one or two differential that you need to look for your in your cases. So is it seasonal allergies? Seasonal is different seasons, so maybe not. Emphysema, they don't tell you that she was a smoker, but emphysema can come from other causes. And emphysema, that are chronic cougher, is not every 3 months that is coming back. So this one need to be eliminated. Chronic bronchitis can be smoker, but we see a kind of chronicity in her cough that make you think that maybe that is the case. Asthma, they don't talk about wheezing in this case. They talk most about the cough that is productive and the different portion during the year. Tuberculosis, there's no sign of fever, there's no sign of hemoptysis, maybe or lost weight. Hemoptysis is not always the case. Lost weight, usually it happens, and also it's not a risk factor of tuberculosis in this case. So what are you going to think? What do you think? What would be the answer here? Chronic bronchitis. You agree with the Maya? I'm deep in bronchitis. Sarah, what do you think? Raphael, what do you think? Just answer A, B, C, or the C. You can write it down. You see, there's the chat part. This is where you can write down. So you think C, and C it is. Yes. So it's the chronic bronchitis. What you notice in here, they tell you, in the case that this is chronic bronchitis, chronic coughing. Chronic coughing is from what? From a bronchitis. So you have it already there. In this case, I even put you the answer in here. An adult patient present with persistent headache, CT. The persistent headache can be many, many causes. So you can put a kind of 10 differential diagnoses in here. A CT scan of the head demonstrates 2 centimeter spherical mass. So mass in the head can be either tumors, but also can be parasitic, which you need to determine at the junction of the white and the gray matter. So the location are mostly for the emergency, and the lateral aspect of the cerebral hemisphere. Which of the following would most likely produce these lesions? Is an adult. So here, the answer that they give you are the answer of tumors. So the first thing that comes to your mind, since they telling me this is a tumor, the first question that I ask myself is, what are the most common tumor of the brain? And the most common tumor of the brain would be metastasis, first. Second, going to be depend on the age, astrocytoma, glioblastoma. That is mostly for adult. So since it's an adult, I might think two things: glioblastoma or metastasis. I'm going to look if I have this in my case. But if it was a glioblastoma, spherical mass, usually cerebroblastoma, you're going to have a kind of hole inside that look like a lampshade. and invading very, very fast. And here it seems to be a kind of solid mass. So astrocytoma, no, unless they tell me astrocytoma type 4. Ependymoma, location of the glioblastoma multiforme, possibly, but the description doesn't match. Meningioma, not, it will not be within the white and gray matter. That would be mostly outside on the meninges itself. And also, they need to tell me if it's an elderly, because meningioma usually starts around 40 years old and grows slowly without symptoms. Metastatic carcinoma, yes, because I know that they are number one causes of cancer in the brain. So this will be my locking answer, and the answer indeed would be E. So you see how you eliminate from what you have. All the information are within your case. You just have to eliminate smartly what would be the answer. In this case, you have 60 years old white man present to his primary care physician for an annual examination. He has a history of hypertension that is controlled with diet. Already here, you need to know what are the complications of the hypertension, what are the treatment of hypertension, and remember, and here is mostly diet and medication. So it means diet by itself did not work, and they give medication. And you need to know what are all the treatments for hypertension. Remember, hypertension is one of the high yield subjects for USMLE step 1, step 2, step 3. For one reason, is the silent killer. You're going to end up with heart failure in long term without treatment. So you need to know it as the easiest treatment, like diuretic, towards beta blockers and everything else between. And also for the medication for hypertension, you need to know the side effect of this medication and which group category each of the group of medication need to be given. So those are the big subjects. So he felt well. There's not much a problem. He was, so notice the past 10 months a non-resolved small bump on his face. So here you see that the questions start to go from someone that has hypertension, treated, elderly, white man, to something of the skin. It was not expected. Is that related to hypertension? Maybe, maybe not. It doesn't seem to be it. Occasionally bleed when he scratch it. So something that's bleeding, first thing might think about cancer, but it can be benign as well, but cancer always number one. And he is a banker. What does it mean? He doesn't expose himself to the sun as much, so that bump can be melanoma, and does not spend much time outdoors. So this is someone that is very sensitive skin to melanoma mostly, but has frequent sunburn as a boy. Examination reveals 0.6 centimeter flesh colored papule with an telangiectatic vessel, a rolled edge, and slight central crusting located in the cheek. There's a picture, black and white. Which of the following expected progression of this lesion? So if you think it's a cancer, the expected is going to be invasion of the tissue underneath. So this is the lesion that is within the cheekbone. This is the ear, and this is the lesions. There's a ulceration. You need to look at the border. So it doesn't look like a melanoma, but what will be your diagnosis? The question here, you see, as what I was saying earlier, is the first thing that you're going to think of is what will be my diagnosis here. Actually, the question, they're going to turn it other ways. They're going to tell you an initial radial growth phase that is followed by vertical growth phase, prognosis is significantly related to depth of the lesion at the time of excision. So understand this answer. Good prognosis if excised early, but a propensity of lymphogenous metastasis mandate frequent follow-up after excision. If you have metastasis, you don't do follow-up. You do chemotherapy or radiotherapy. So this one occur exclusively within the epidermis and has no malignant potential. The way that it looked like more malignant than benign, especially ulceration and bleeding. I don't like that. So this one, maybe. It will be eliminated. Slow growth with destruction of local tissue that may extend along nerve to penetrate into your central nervous system. They're not talking about any facial nerve involvement or trigeminal nerve involvement here, but slow growth with destruction, local tissue that might invade the nerves. This I can keep it in mind because I'm thinking maybe cancer. Will remain stable for indefinite period. If it's cancer, it's never going to be stable. So what is the answer that you think? How deep? What do you think? Then I think D. Slow growth or destruction. And deep D. But you're a fail. See, an answer that takes too long to come means I don't know. And this is something that needs to be avoided. So the answer would be D. So Delmaya and Deep answer it. Did you answer this, Rafael? Okay, good. So yes, it's the typical description of what? A malignancy. Slow growth, destruction, although that some malignancy grow faster, but this one slow grow, slowly destroy, is going to involve the nerve, penetrate the nerve, and destroy it, and then metastasis to the brain. So the cancer is cancer nodular basal cell carcinoma. Remember one thing that the basal cell carcinoma do not metastasize. They invade, but do not metastasize. This is one of the cancer that never metastasizes. Keep that in mind. But it invades. So this is why it's pretty much matching with the answer. One thing is don't delay, don't procrastinate and doing question and doing stuff. Okay, I'm not going to do it now. I'm too tired. I'm going to do it later, and then later never comes. And you have an exam. You have a program for 3 months, and it take you 2 years to do it. After 2 weeks, you didn't finish what's supposed to be done in 1 week, etc. So those try to avoid them. These are killers. These are mostly laziness. And remember, unless you don't want to take this exam and do something else, try to be pretty much efficient and aggressive in your study. Once again, block 50 questions. So now when you do the 50 questions exam, when you do them by yourself, if you score 45 to 48, this is excellent. This is what you need to get to. 50 would be better, but if you score 30, between 30 and 40, or 20 and 30, that is not good whatsoever. It means you still have a lot of problems. And if you score 32 on 50, don't go to take your exam because you're going to fail it. And this is what I said, once again, NBME will be one of the exams that will tell you not to do that. But at the beginning, yes, you might have these scores. But after a while, when you study, you're supposed to answer them. And remember, all material that you did in the beginning, you need to review it again and again and again and again. So by doing questions, this is how you're going to review them. So consistency will usually get you a high score. So by doing, if you have 30 on 50, so it means 20 questions are not answered, you need to ask yourself why. You have a lack of some of the information. Remember, most of you are having issue with biochemistry. Biochemistry is going to be your deadly part. A lot of you are going to have pathology issues. Some are very good in farm, like for example, on deep you're good in farm, but you're lacking in other areas. Delmaya as well, you're lacking some areas and also certainty. You need to be sure of yourself when you do stuff. But all of you are getting better since we start, which is very good. Sarah, you are out of the wood for now. Yeah, I know. Sarah, you are out of the wood for now for the step 1, but you have the step 2 coming, and you need to start to study now, not yesterday, not tomorrow. You wasted already 3 weeks for your rotations. uh, Stop laughing. So remember, it's like everything in life. You're going to fail sometimes. You're going to win sometimes, but don't fail the day of the exam. You need to be pretty much 100% on the goal. That's what I said so far. Uh, there is, for example, this is how to create flashcards. Uh, Most of my students are familiar with this. So, for example, on the face, you're going to you write what are the drug-induced lupus. So when you write this, it's not only writing what are the different drugs that would lead you, but each of these drugs you need to know mode of action, side effect, how you can find it within biochemistry, and what's the mode of actions. So, for example, drug induced, you have antihistones, antibodies, and also you need to know what is the clinical representation of drug-induced lupus and what is lupus. What is the lab that you're going to ask for lupus? So all these you see for one phrase, you can create at least 20 slides. And don't wait until you're going to do the lupus or something like this. No, you read it, you don't know it, or you're not sure, create your flashcard right away. What is lupus? Who are going to have lupus? Clinical presentation. What is the lab? What is molecular biology underneath it? What is the treatment for lupus? What are the complications of lupus? And then the drug-induced lupus, understand it. What does it mean, drug-induced lupus? It means drugs that will give you clinical symptoms of lupus, not drugs that will give you the disease of lupus. So all of them will be very specific. And there are some of these drugs that are pretty much super high yield and pretty much used all the time. So this is why you're going to take the antihistamine antibodies later on. Talk about it. Create a flash. The first line will be antihistamine antibodies, mode of action, side effect, what do you need it for, and etc. For example, mental retardation, fetal alcoholic. You need to read about it because this is high yield Fragile X syndrome. So these are questions mostly genetic, including biochemistry, including pathology, and a lot of clinical and prevention as well in those type of questions. So you see that I don't write phrases or whatever. It's straightforward to the point. Because when you're going to read your questions, that's exactly what you need to have as differential in your mind. You don't have to bullshit yourself around. You don't have to overload yourself. You go directly, this is my 3 differential. Now I need to eliminate from this differential. And that these become keywords and become very important for your answers. So as when you take your score, if you have 94% NBME, that is around 260, and this is what the score that all of you need to reach, although some people did disappoint me, and try to avoid everything. Everything here is toxic, so don't go there. Only go, look at this. That is not toxic. So these tests usually are not expensive. There's an NBME. There's 19 tests now for the NBME. So you can take once a month. Leave 2 tests at the end before taking USMLE, because this is what we're going to tell you what will be your score for USMLE, and if you're ready to take it really or you're not ready. Remember, like I said earlier, at certain point you're going to find a wall. You're going to score the same thing. It means that you cannot go further. Just go and take it, and that will be your score at the end. So don't worry, you're going to do fine after taking your test. Take a vacation, well deserved, and this is some of the board review in the carousel. He was sweating like hell because question after question after question. You remember Eurocanalism deep in here, and sweating as well. Some of these students are came back to the board review. Some Here, this one is ready, is doing his residency, etc. We were doing EKG live. This one passed his step one. So all is good news. So thank you for listening, and these are the references. And well, any question? You're very welcome, Marcelo. So you can join anytime now. That's what we are doing, and usually we do 2 hours. We go over lectures. Right now we are doing the liver, and so we did the biochemistry already, the protein and stuff. But we're doing the pathology of the liver right now, and then we start pharmacology and stuff. And next Saturday we'll do the X-rays. Probably it's going to be between 5 to 8. Raphael is supposed to be okay with the X-rays, no? But yeah, I'm going to go over the generality of the X-rays to understand, and then I go about the specific X-rays for USMLE. So Sarah, that will be important for you for your step 2. So X-ray are always good. I did teach you this already, but if you can, I will remind you. I will send you an email. And everybody, well, we meet you on Monday. And so I'm going to put this video again on my on YouTube and on my website, so you can go over it again and look at the important information. And also, I'm going to send you the PowerPoint in a few minutes as PDF. You can go over it as well. And if you have any questions, well, you have my email. And everybody else, Delmaya and Omdeep, I will talk to you on Monday at 6. So have a nice day and go to study. Take care.